Let's discuss about an autoimmune disorder called as Myaesthenia gravis. What is this Myaesthenia gravis? Myaesthenia gravis is an autoimmune disorder where the autoantibodies are produced against the acetylcholine receptors present in the postsynaptic membrane. Type of autoantibodies seen in case of Myaesthenia gravis are the anti-acetylcholine antibodies, anti-MuSK antibodies, anti-lipoprotein receptor 4 antibodies. And these are the types of antibodies seen. And the variants of Myaesthenia gravis are the ocular Myaesthenia gravis, early onset and late onset Myaesthenia gravis. And the clinical features seen in case of Myaesthenia gravis are the fluctuating muscle weakness, and muscle weakness, that is muscle weakness worsens after activity, means the patient experience more symptoms at the end of the day. And we also see asymmetrical ptosis and diplopia with pharyngeal involvement. If ptosis is present, this ptosis may be unilateral or bilateral. If diplopia is seen in case of 50% of patients. If pharyngeal involvement is seen, then the patient will experience masseter muscle involvement results in pharyngeal involvement. That is, then the patient experience difficulty on chewing, dysphagia and dysarthria. Less than 5% of patients we see proximal limb weakness. And in case of Myaesthenia gravis, we see expressionless faces, drooped posture, and in case of complication, if it is long-standing or complicated, then respiratory muscle weakness also can be seen in case of Myaesthenia gravis. And let's look into the investigations which help in case of Myaesthenia gravis. IcePack test, which improves the weakness, and tensilon test. In case of tensilon test, we use edrophonium is used. And other tests like repetitive nerve stimulation test. On repetitive nerve stimulation test, we see a decremental response in amplitude and in compound motor action potential. And the most specific antibody estimation, that is acetylcholine receptor antibody estimation or detection. And the most sensitive is the single nerve fiber electromyography. And these are all the investigations which help in case of Myaesthenia gravis. Let's discuss about the treatment plan available for the treatment of this Myaesthenia gravis condition. Here the pyridostigmine can be used, and in case of relapse, steroids with azathioprine is the drug which is used in case of Myaesthenia gravis. And if there is any respiratory crisis or when the condition is so severe, then the main treatment plan available is the IV immunoglobulins are given, and also plasma exchange, that is plasmapheresis is given to the patient. And these are the treatment modalities in the treatment of Myaesthenia gravis. And thank you for watching.